Welcome all to today's RCGP webinar focusing on primary care networks. A few months ago, these three little words hadn't been put together, and now the three big letters PCN have become part of our daily vocabulary.
I'm Alka Patel, GP and Clinical Fellow with the Collaborative General Practice Programme. And today I am absolutely delighted to have with us four very engaging speakers who will be talking to us about their PCN journeys and the art of the possible. They'll be talking about clinical directorship, rural working, and the practical applicability of population health management. So if you have any questions along the way, do type them into the chat box at the bottom of your screens, and I'll be collating them for a Q&A session at the end of each presentation. Any questions we haven't been able to cover during today's webinar, we will answer in our newsletter, so just sign up to the online learning network at gpatscale.rcgp.org.uk. So now, just sit back and join in. And let me start by handing you over to our first speaker, Dr. Tom Rustom. Tom finished his GP training in 2015 in East Surrey. Within 2 years, he was a partner in a practice with the Modality Partnership, and within 4 years, he has found himself to be the clinical director of his PCN.
Hi, Alka.
Fantastic. Over to you, Tom.
Brilliant. Thank you very much for that introduction. And thank you for inviting me to do this. I'm going to just really talk today about what things have been going on for the last few months, and probably the best place to start is just to give you a bit of background about who I am. So I finished my training in 2015 in the East Surrey area. I trained and became a salaried GP at the same practice that I'm now a partner at. After becoming a partner in 2017, I took on roles as the palliative care lead and the child safeguarding lead at our practice, and really, other than attending a few network meetings, I've not really had any formal leadership experience. I think really the reason I think I got asked to speak today was because there's probably a lot of people finding themselves in my situation where this is a new step for them, something that feels a bit strange and scary at times, certainly has for me. I think there's probably a lot of more experienced, clever individuals out there that would be better at kind of doing this kind of thing for me, but I took it on because I'm sort of obviously passionate about doing the job, and hopefully I can kind of make people feel that it's a positive role. And I do think there's probably a lot of people kind of finding themselves in my situation at the moment. So why did I agree to the clinical director role? I didn't really know what it involved when I agreed to it. I'm not sure anybody did. I knew that when I became a partner, when I became a GP, that I wanted to be involved in change in some way and improving things, particularly about working as a GP. And a lot of us struggle. The workload's high. I'm a bog standard jobbing GP, doing 8 clinical sessions since I started. I really felt like improving collaboration between GPs was something that should be done more and more. So when I sort of started getting involved in the network meetings, it was quite interesting, exciting to hear that this role was coming up, which was why I volunteered for it. I feel like personally I'm quite an enthusiastic person and bring knowledge of the local primary care system, so I felt like I'm in a good position to bring those things to the table. And I've had a huge amount of encouragement from my partners, which has been really crucial, to be honest, in giving me the confidence to put myself forward for this role. I think one of the things I just want to sort of plug the Next Generation GP program, which was something that I stumbled across accidentally, and there might be people listening to the webinar today who have been on the program, but it was a really fantastic free thing that was organised, which was 6 evening sessions over a period of months, mainly based up in London, although it's now spreading out nationally, where they'd invite a couple of speakers in each evening, so people like Nick Harding, Robert Barnum, Nikki Kanani, Helen Stokes Lampard, real people at the top of their game, who would come and talk to 100 or so of these younger GPs, so generally sort of first 5 GPs or trainees, who were kind of just optimistic about general practice and wanted to kind of develop into leadership roles. And I learned a lot from that. I learned about kind of the ways that change comes about, how to make change, how to operate within your own sphere of influence, and that things don't always go the way you plan them. And it was great to listen to the speakers, but what I found even more useful, to be honest, was being in a room with 90 to 100 other young GPs like me, some of who were just doing the most amazing things. I'm bumping into people that are working for NHS Digital, Darzi Fellows, people that have done CCG roles, working for CQC, and I had no idea that young GPs like this were out there. And it was really, I came away and I think just bored my wife brainless, talking about how inspired I felt by this whole program, and it really was a flashpoint moment for me, and I think that really gave me the confidence to kind of move on and volunteer for this clinical director role. Also, to be honest, 8 clinical sessions a week was starting to take its toll a bit. And one of the sort of positive side effects that have come out of doing this role is that I'm now doing 6 clinical and 2 sessions as the clinical director. And already in the last couple of weeks, since that time has been taken out, I've definitely felt some of the stress from clinical responsibilities go down, which has been nice. I wasn't expecting that to happen, and it's been a nice side effect actually. So how have I been feeling along the way? So I pinched this diagram. I don't know if you can see it that clearly, but I pinched it off one of the clinical director's WhatsApp groups. So I haven't kind of referenced it to anybody, so apologies if this is yours and I'm using it without permission, but it did sum things up for me. Not just with this, but in life in general in many ways, but particularly with the clinical director role. And yeah, so you put your hand up, you feel really positive about it, and then all of a sudden the reality hits home about the fact that you don't know anything about what you're supposed to be doing, and neither does anybody else. So I quickly sort of found myself on this trajectory down the initial slope. But I have to say, it has been going down that. I have felt stressed. I've felt emailed out, but I'm just looking forward to the day when I can sort of be at the other end of the bridge. And I'd say that probably now I'm just stepping off that downward slope and moving across onto the bridge, where I'm just kind of finding that balance between, my life outside of work, my life at the practice, and my life as the clinical director of the PCN. And I've kind of come out of the sort of despair and panic, and now I'm just starting to find a bit of balance, which is nice. And for me, this is a completely new language, really. I had a sort of vague grasp of commissioning and how NHS politics worked, and a sort of an understanding and an appreciation of it, but not to the depth that I've had to really get to grips with it over the last few months. And it's been a really, really steep learning curve. I can't begin to, almost like first day of medical school learning curve. It's just something so new. But that has been really refreshing and enjoyable for me. It's kind of fired me up and got me doing and looking at things differently. And although there's still a huge amount of unknowns each day that I'm doing this, and I'm just picking stuff up all the time, and that's really refreshing and enjoyable. I'm definitely somebody that suffers with imposter syndrome, so I constantly battle with this feeling that I'm not good enough for it, and that's a personal thing. But I think doing this is been quite good for that, because I'm challenging myself and trying to reassure myself that that's not the case. And I'm very, very fortunate that I've got a lot of supportive GPs around me who kind of helped me through this. Definitely affected my sleep. The kids don't help with that, but when the 1-year-old wakes up in the middle of the night, it is different. And you start thinking about bank accounts and legal schedules. That's definitely been a knock-on effect, but that's just one of those things. I'm quite proud. It's something that my mum doesn't know what a PCN is. I'm not sure she will ever understand it, but to tell her that I'm the clinical director of our PCN was a nice thing to be able to do. I'm excited. I'm quite enjoying being popular in a way. You know, I get invited to a lot of meetings, and when I sort of sit back and think about it, I realise that actually I'm quite influential in many ways, and so I've had to think about the way I present myself and how I go about things. So that's been really enjoyable, and I'm quite interested to know what it'll lead to. I don't intend to make a career out of being a politics or management or anything like that. I really want to basically make the majority of my work clinical, but to have something slightly different where I can hopefully make a bit of a change around the local area is just great. So what have I been doing? So part of the reason that led to this webinar was that the RCGP, I received an email from, I can't remember who it was, saying, would you like to go to an RCG sponsored event to go and see how primary care home works up in Luton, Bedford, Luton, Milton Keynes area. And so it was good. It was a really interesting day. I hadn't didn't know much about primary care homes. I didn't really know much about the National Association of Primary Care or Population Health Analytics. So they started talking about all this amazing stuff they'd done in the primary care home there, and it was just really nice to hear about the innovation that had gone on. And speaking again with other enthusiastic GPs, or seeing enthusiastic GPs and what they've done, you know, getting mental health workers into surgeries, speaking to the local leisure centre and getting sporting things set up for kids, and the knock-on effects that had. And that was just, again, another really inspiring group of people to see talking. But again, it wasn't so much them, like the next generation GP. It was more about the people that I met that were attending it. So I got off the train and bumped into another clinical director who was just from the patch a bit south from me, who was basically carbon copy, feeling like I was. You know, he'd never done anything like this. He was my age. And so it was, I think for both of us, it was both kind of just quite like, oh yeah, you don't know anything either. Great. Okay, fine. So we can talk and see what we're going to do with this. And so I bumped into him in a few events since, and that's been good to know that there's other people feeling the same way as me. And following that event, I got a chance to debrief with you, Alka, about it, and that was good for me to reflect on what I'd learned, and I think just having the opportunity to reflect on that does give you makes you realise what you've taken away. So I'm also really lucky that locally I've got lots of experienced GPs around me who are willing to support, including other clinical directors in our patch. So we've got a WhatsApp group. Everyone's sick of WhatsApp. A lot of them are on mute now, but it's just the 5 of us. And so if I've got any questions, I ping it across, and they're really responsive and really helpful. We've got a really supportive federation, which has been fantastic. I can't kind of understate how good the federation's been, and my personal partners have been great, and I think they can see the added value that I bring by doing this role. Even though I've been taken away from the practice for a day, I think they see that this is something that's good for the practice overall. We're part of the modality partnership, which has been really, really supportive. We had a 2-day summit up in Birmingham, where all the clinical directors from the modality partnerships around the country came together, and we started looking at strategies going forward about how the primary care networks were going, and that was great, you know, and that was sort of more again a really new experience for me, and taking me that step beyond what the primary care network where I am to what we could do as a partnership across the country and support all the PCNs that we're involved with. And also, you know, they've got with the modality partnership, they've got people there being able to talk me through and help me understand the accounts and some of the more legal stuff, which has been handy. Recently, we've had some help from the King's Fund. So the Federation helped get some money so we can have a action learning set with the King's Fund. So we just had our first meeting last week. We had representatives from all the practices in our network, and we sort of sat down and looked at what we can do across the network, and came up with some quite good plans, and just small projects really that would get things going and get things moving. I thought the BMA Clinical Director Conference in London was really good. Ockham Healthcare, the blogs and the podcasts by Ben have been really useful. You know, I listen to them on the way in the car. And the WhatsApp group, yeah, it is busy, but I mean, how amazing to have people like Nikki Kanani and Farah Jamil just coming straight back in with answers to questions. And yeah, there's just been a lot of support. Personally, I've just been trying to be disciplined with how I work. I've not worked from home. I'm not used to doing emails and all that kind of stuff. So I had to be really disciplined. I was finding myself doing emails at 10 o'clock at night, and my wife was not happy about that. So we kind of had to set boundaries and say, right, this is when you're going to be doing work. If you're going to be working from home and on your days off, you're only going to do it at this time. Otherwise, you need to, spend time with me and the kids. And we got that sorted fairly early on, and that's working quite well. I'm trying to say yes to everything, getting lots of invites, because I want to spread myself around, but also I probably need to say no a lot more, and I'm starting to get the feel of what things that I need to go to and what things are less necessary. I've been reading lots of legal documents, which is hard work, replying to emails, trying not to bury my head in the sand, and just being open to invitations, really. And that's kind of how it's been going for the last few months. So going forward, I really see my role, it's difficult. I guess just really trying to facilitate things, and trying to remain independent, trying to stay positive, being patient with the process. We want to get things happening in our network, but also I'm trying to make sure that we've got all the foundations in place that in a 2 or 3 years time, no one's going to turn around and say, where are the building blocks that you started this all from? So I'm trying to just nail down all the basic stuff at the moment, still trying to sort out finances and who's going to hold contracts and legal stuff and all that. We're still trying to work all through that, but we're trying to do it alongside the more interesting stuff that's going to help the GP surgeons and patients as well. I'm going to sort of try and keep my feet on the ground as much as possible, and not put too much pressure on myself. And the initial stress and anxiety around meeting deadlines, I've just taken a step back, to be honest, and just said, I'm gonna, what will be will be. And the other network members are all really good at kind of supporting me, and we're quite a relaxed bunch about that. So that's not too hard to do, actually. Like I said, I'm going to try and be disciplined. I'm going to keep looking around for sources of local support. Ask questions, because like I said at the beginning, there's lots of people that know a lot more than I do, and I plan on just trying to draw on all of them and then together trying to formulate a plan of how we can make things work. I'm going to enjoy the variety, do something a bit different, and probably just see how things go. So I hope that's been useful for some people, and yeah, happy to answer any questions out there.
Fantastic, Tom. That was a really heartwarming, insightful presentation. Thank you so much for your honesty in presenting your journey. And I think with the listeners, a lot of echoes about what you were saying should resonate with a lot of people. You've given lots of insightful tips into things that have helped you along the way. Next Generation GP seems to have received a real good thumbs up. You talked about Ockham Healthcare, RCGP support, BMA support, WhatsApp group. So clearly there's a lot of support, and it's just a matter of navigating that and tapping into the things that you find really, really helpful. So thank you so much for that. One question that has come in, actually, if I can put that to you, is one of the listeners is asking, have you had any support with data analytics and population analytics in terms of where you're at now?
Yeah, so we've again, that's where the Federation has come in, actually. So the Federation have got someone who does that job, and we're just starting to look at how we can use that to supplement our MDT meetings that we're going to have once a month, and also a kind of nursing home / home visiting project that we want to get going. So I'm very fortunate that the Federation employed us someone specifically to do that job. And so yeah, we have got something like that in place. Sorry, Alka, you're I can't hear you anymore.
Brilliant. Is that better?
Yeah.
Brilliant. Thank you, Tom. Another question that's come in is, from your journey so far, what do you personally have the key issues for PCNs moving forwards?
I genuinely think that they've got it's a really good opportunity. The more that I listen to people who have been around in the NHS, GPs that have been around for a long time, they say that this is something that's really different to what's come before, and from what I hear from them is that we've been given a decent amount of money and a different level of control, and I really want GPs to make the most of it, I think, and I want to make the most of this opportunity, because I think the challenge is that although there's been money given, I've still only got 1 day a week. I'm still only one person, and really, realistically, for a population of 36,000 people that we're looking after, am I, Tom Rustom, little old me, actually going to be able to do justice to what the ambitions are with 2 sessions a week? And I personally, and others might be able to. I personally don't feel that I'm going to be able to do it to the level that I would want to, and that's why I've had to kind of be a bit more, just not putting too much pressure on myself, because you can say, right, I want to make this work, and then all of a sudden your Saturdays and Sundays and your days off are eaten into because you're trying to make it work. But it's not fair to do that, because GPs are always asked to just do above and beyond, without getting remunerated for it properly. So I would like to see more money coming through it, and I think there is the CCG, certainly local CGs are starting to see that, and I believe there is going to be some additional money coming through, so that we can really make this thing work, really make it work. And I think the ambitions are brilliant, are really, really brilliant, and I just think that we just need to kind of keep going and keep supporting us to do that. But it is going to take, ultimately, I guess, more money and more people, to be able to do it.
Thank you, Tom. I guess that's where collaboration really comes into it, not just collaboration on the delivery of projects, but collaboration also in the back office type of support in terms of getting this thing going, especially as you allude to that, you've only got this 1 day a week for yourself, but actually sharing that time with others is probably a very useful way of moving the journey forward and keeping that sense of ownership with everybody in your collaborative working. So what sort of collaborations have you sort of built on? Another question that's come in is about that, is where are you collaborating and what sort of projects have you got already that you might be looking at?
Yeah, okay, so we're quite lucky that we've got some very enthusiastic patient volunteers that we call the health champions, which is something, it's a national thing, from Altogether Better scheme, and 2 of the 4 practices in our PCN have got practice champions, and the other 2 practices don't, and we're going to try and get them to forge a PCN health champions group, and one of the things that we're going to sort of task them to do is to try and get all, or as many people as they can, and it sounds like quite a small thing, but I think it could make a bit of a difference, is try and get as many of the local population registered with the NHS app, because one of the things that I think all GP surgeries struggle with is the phone lines, so people phoning in for repeat prescriptions and all the paper associated with that, whereas with the NHS app, I believe you can just order your prescriptions at the click of a button, and everyone's got a smartphone now. So we're going to ask the health champions to try and get as many people registered with the NHS app, so that we can start to, so the advantage of that is that, first of all, we're getting the health champions working across the network rather than just in individual silo GPs, and secondly, hopefully that's going to have a knock-on benefit to the GP surgeries in reducing some of the back office work flow stuff. So it's kind of like a baby project, but actually it's amazing. I've never done anything like this before, but it's amazing actually how much thought and time and work needs to go into that, actually, just that small thing, and it relies on a number of people doing the bits they need to do in a timely manner to be able to take it forward, and so that for me is I'm quite excited about it in a way. It probably sounds a bit sad, but I'm quite excited about it because it's kind of like something we're growing up to, at our level, and yeah, so I'm quite excited about that. We've also there's some money that's come for a fellowship, like a post CCT fellowship. So a newly qualified GP is going to be doing. We're going to have him doing some nursing home reviews for us and a bit of a home visiting scheme. So we had the fundings from a historic thing a year or two ago, and it's really only for 3 of the 4 practices, because we're a bit unusual because we're across 2 CCGs. We've got 3 different IT systems, which is a bit of a headache. But we kind of decided, we said, well, look, the money's there for 3 of us, but we're going to get the 4th practice in as well, because I think if they're going to work, we need to just kind of set the ground rules and say, look, actually, it's going to be in all of our benefit to start sharing resources. Let's not bean count. Let's not try and split small amounts of money. What's going to benefit us is that we're all looking after these care homes, and if we get some continuity and a good GP going in and reviewing the patients, doesn't matter whose patients they are, because that's going to change over time, then it's going to benefit us all doing that. So those are kind of like 2 of the projects that we're going to try and work. But like I said, I think the next things really for us is thinking about us getting a link worker. We haven't kind of really discussed how we're going to use them yet, and certainly haven't got to the point where we're putting job adverts out, but that's something we're kind of working towards. And the same with the clinical pharmacists as well, and discussing how we're going to use them, because they're going to be a useful resource. If we're going to get these allied health professionals in, we need to think about who's going to supervise them. Are they going to have time for that? Are they happy to supervise them? Do they have any experience in supervising people from different professionals? And if the GP's not going to do it, who is? And if we're going to get these people into primary care networks, we want them to feel part of the team, and we want to embed them into it. And the IT is just going to be so crucial. I mean, it's a massive headache, us being on 3 different IT systems, and so it's kind of those things that you kind of don't necessarily think about until you're doing it, that actually are kind of the exciting things that you can get to grips with, and actually will make the biggest difference, I think. But I guess time will tell.
Fantastic. Thank you so much, Ben. Certainly can feel your excitement and passion. It's really, really tangible. So I hope that's also passed on to some of the listeners today. There have been a couple of other questions that have come in around social determinants of health, but we are going to need to move on to our second speaker, unfortunately, but we will answer those questions through the newsletter in the next week or so. So thank you so much.
Okay.
Great. A final thank you to all of our presenters today, who certainly have shown us the art of the possible, and I hope we can take away with us their energy and their enthusiasm into our own working practices. So do all of you who are on the webinar at the moment, do visit the website for more resources, do sign up to receive the regular newsletter, and if you've got any more questions, do send emails to any of us, gp@scale@rcgp.org.uk, and additionally there have been some questions about additional support. So the RCGP have got a primary care development service that can certainly provide additional support tailored to your needs, so don't forget to have a look at them as well. And so to all of us and to all of you, all the best with your PCNs, and remember to enjoy the journey, and we and our patients will certainly flourish through the benefits of collaborative working.